Health insurance is now the single largest household expense, and costs continue to outpace inflation. Yet, for the most expensive product you buy, you have virtually zero agency in choosing what you actually purchase. Compare that to buying a home or booking a hotel. In those markets, transparency and shopping drive up value and lower costs. In healthcare, you are typically told what to buy by an employer. OSCR Health is built on the thesis that the U.S. healthcare system must become a consumer-driven health economy. Under this model, individuals own their plans directly, keeping them from their first job through retirement. Moving away from the employer-mandated model forces health insurance to compete on price and quality like an everyday product. This shift is designed to address the structural inefficiency that keeps costs rising. Surviving in the individual insurance market is difficult. For the entire industry, 2025 was a year of significant recalibration. Rising market morbidity and new patients created massive headwinds. OSCR reported a $396.3 million loss. In response, disciplined cost execution led to a 160 basis point improvement in their SG&A expense ratio, indicating the first steps of a broader efficiency plan. This vision requires more than just high-level goals. It requires a business model that can withstand the brutal math of the insurance market. OSCR's 2026 performance serves as the ultimate test of that model's viability. Leading into 2026, OSCR pushed its physical footprint into 20 states, covering 573 separate counties. Within that footprint, OSCR nearly doubled its market share, leaping from 17% in 2025 to 30% in 2026. That geographic expansion led to record growth in open enrollment, with the company reaching a total of 3.4 million members. They attract these users by moving away from generic plans. Instead, they launched targeted lifestyle products tailored to specific chronic conditions like diabetes or menopause. Members navigate these plans through a proprietary tech stack. OSCR uses AI tools to guide people to high-value care, providing upfront cost and quality scores before a member even books an appointment. This combination of personalized products and AI-assisted navigation directly accounts for their 58% year-over-year member growth. A major part of OSCR's growth strategy involves ICHRA, or Individual Coverage Health Reimbursement Arrangements. Under ICHRA, instead of a company buying a one-size-fits-all group plan, the employer gives workers a tax-free stipend. Employees then use that money to shop for their own individual health plan on the open market. To capture this shift, OSCR acquired Lucy Inc. and IHC Specialty Benefits in 2025. These acquisitions provided the direct enrollment technology and broker infrastructure needed to process this new pipeline of employees. This strategy allows OSCR to access the massive employer-sponsored market while keeping the end user firmly within a consumer-driven individual marketplace. But growth is secondary to operational sustainability. Scaling to millions of users is only effective if the margins are positive. To improve those margins, OSCR exited the small group market, terminating its partnership with Cigna. This allowed the company to focus its resources exclusively on the individual and ICHRA segments. The company also pursued aggressive efficiency targets. Between 2023 and 2025, OSCR dropped its overall SG&A expense ratio by approximately 7 points. Crucially, they managed to lower their medical loss ratio, or MLR, to a highly competitive 70.5% by early 2026. By reducing administrative overhead and managing the cost of care more effectively, OSCR is attempting to prove it can deliver healthcare at scale for less money. This chart shows the immediate financial payoff. In the first quarter of 2026, OSCR's operational earnings rose to $704 million. Adjusted EBITDA for that quarter reached $727 million, a clear indication they moved past the previous year's difficulties. With these results, OSCR has reaffirmed its guidance for the rest of the year, targeting significant margin expansion and consistent profitability. These metrics prove the consumer-driven health economy is a financially viable, scalable business reality. If this model continues to expand, it creates a future where millions of Americans own their healthcare plans for life, making the country's largest household burden subject to a transparent, competitive market.